Good morning, evening, afternoon for everybody around the world joining us again. Thanks for coming to the final fourth part of the Humanitarian Spatial Technologies webinar series. Today we're going to be talking about beyond mapping. Myself and Dr. Gregg Greenough will be discussing the use of geoanalytics for humanitarian healthcare. Just a little bit about us. Next slide, please, Erin. Next slide. So, you guys have met me before a couple of weeks ago. My name is Erica Nelson. I am the co-director of the Humanitarian Geoanalytics program at the Harvard Humanitarian Initiative. By night, I am an attending physician in the Department of Emergency Medicine at Brigham and Women's Hospital and Faulkner Hospital. And over the past decade or so, the predominance of my research has been looking at spatial analytics and critical geography for humanitarian research and programming. My Twitter handle and my email is down there in the corner, and I think Ms. Syra Khan will put those into our YouTube chat from time to time. If you want to reach out, continue this conversation. This is a burgeoning conversation, and we really hope to collaborate and continue to propagate the message over time. So we're going to move on to the next slide, please, Erin. Greg, would you like to introduce yourself?
Sure. Thanks, Erica, and welcome everyone. This is fun for us to be a part of this discussion, and we do want to emphasize this is a discussion. So please feel free to talk into the chat as you need as we go through this. My career trajectory is very much like Erica's, maybe a little longer in time. I'm also an emergency physician at Harvard Medical School and at Brigham and Women's Hospital. And my area of interest in my research has been over the years epidemiology and humanitarian crises, particularly humanitarian populations, looking at health outcomes and so on. I came to geospatial analytics over time because I see its value in being able to look at the spatial relatedness of a lot of health outcomes, and so we'll elaborate on that in the next in the session today. That's my background. So let's start.
Excellent. Thank you, Erin. So today we're going to have a discussion about geoanalytics for humanitarian healthcare systems. The first thing we're going to address are what are the gaps regarding the use of spatial data in humanitarian health systems. We'll talk about how spatial analytics can be leveraged to improve those health systems, and we'll give a few examples to talk about. And then we'll go through some of the challenges of adopting spatial analytics and what we really think needs to happen next. So let's just start off with what are the gaps regarding the use of spatial data in humanitarian healthcare systems? I'm going to field that to Greg first. What do you think?
You know, we've been really good about using spatial data, at least for operations, and that I think, you know, for sure we're used to. And it's pretty unusual for a humanitarian operation really not to have somebody in place who can use spatial information, right, for operations. So this is logistical data, you know, roads, facilities, being able to put attributes onto it. But the real question does become, what do those mean necessarily in terms of health outcomes? And just to give you an example, I mean, you know, if you have a high mortality in an area, the clusters in an area, that's a spatial issue. What are the things that cause that? What influences that? How does that change how we approach the disaster at hand? So those kinds of that kind of link between what space and time is to health outcomes is pretty important, and I think there's a lot we can do to explore that. That's number one. I think number two is that there are a lot of other disciplines out there that affect health. We're going to use an example later on this morning about climate, for instance. Climate is spatial, right? It's spatial and it's temporal. And everyone in the world is now being influenced by changing climate. And you could argue that climate affects health, right? Directly and indirectly. So how do we, as humanitarian health experts, particularly epidemiologists who are used to using population data, how do we incorporate that spatial understanding of what happens to people from other disciplines? So, climate being one of those things. So I think that's, an example where we have all these disciplines that have spatial information. We have population data, which is also geocoded and spatial. How do we bring those two together to say how much these other disciplines influence health?
I think that's a really good point. I think one of the things that's really compelling is that there are multiple pieces of this missing. So we have spatial data with regards to demographics, climate, pollution, socioeconomics, all of that sort of thing. But we don't really have the conceptual model for linking these things together spatially and understanding even how to associate kind of these spatial variables with population outcomes. Like, that conceptual model doesn't exist. But moving even further on, there's yet to be anybody who is doing like systematic evidence-based standardized spatial analysis. I know that it is certainly burgeoning within environmental health. It's definitely happening in some realms of global health, but also very much public health, right? So looking at clusters of within an outbreak is a centuries old now practice for epidemiologists, like harkening back to the John Snow water pump like representation of how we understand and how we start to draw hypotheses around epidemics. But I think that really applying that to a humanitarian healthcare system we're a little bit behind. And I think that there's such a tremendous amount of power and insight that spatial analytics can provide us in not only pursuing new hypotheses and thinking differently, but also by like creating more targeted and efficient and hopefully efficacious programming in the humanitarian healthcare sphere.
I couldn't agree with you more, and it makes me think of a couple things. One that you mentioned, if you look across public health in general and how spatial analytics have been used within public health, I think there's been two main areas. One was environmental health, as you mentioned. The other is infectious disease modeling, right? I mean, I think both of these areas within public health have really pushed the envelope in terms of applying geospatial analytics to their work. And I think we can learn from them as humanitarian health, public health people.
I completely agree with that. I do want to also shout out to people outside of the healthcare realm. So looking at like the humanitarian logistics field, looking at that discipline and their ability to pull in all of these spatial variables, thinking about infrastructure, thinking about access, thinking about network analysis, and doing like really incredible optimization algorithms. That is something that we can unquestionably harness in order to identify what the needs are and get them there in a particularly like statistically significant but robust way.
Right, and it means that, as you said, there is the technical expertise out there. I think taking it sort of the next step to actually be able to do the modeling and inferential statistics is and it's a little bit challenging and it's a little bit intimidating. That's true, but the expertise is there to be able to get to that next level.
Certainly. Well, since we've kind of talked about the gaps so far, I think we could probably move on to the next question on how can spatial analytics be leveraged to improve humanitarian health systems. We've kind of talked a little bit about how epidemiologists and logisticians and environmental healthcare and climatologists are using spatial analytics, but maybe we kind of move further into some of these examples to be a little bit more concrete so that people understand exactly the potential and we can kind of illustrate that for our audience. So do you mind moving to the next slide, please, Erin? So one of the things that Greg and I have looked at, and I dare say published a paper on it. We looked at what was actually being done with regards to the use of spatial data in the humanitarian healthcare sphere. And the predominance of what is being done is the reproduction of what one would call just cartographic information or choropleth maps, which everybody here has seen, where you're basically taking and classifying and visualizing raw data, or even sometimes prevalence rates. But usually these things do not include any higher level analytics. They are not necessarily combining different variables. Sometimes you might see representations of healthcare infrastructure and, let's say, disease prevalence on the same map, but they're not bringing them together through sophisticated means of statistical analysis. So what Greg and I are really arguing for is that we take all of this potential that spatial analysis has and really apply it to the humanitarian healthcare field. So we're going to move on to the next slide so I can kind of talk about what that looks like. So this is an article that was actually just put out back in the summer of 2020 by Carrillo et al. Or Carrillo et al. I apologize if I'm mispronouncing that. And it's looking at the impact of social vulnerability on COVID-19 in the United States. It's an analysis of spatially varying relationships utilizing a geographically weighted regression model. Now, I'm not going to go into the very nerdy statistics about what a geographically weighted regression model is. I anticipate many of you already know what a linear regression model is, or what a non-spatial regression model is, in which it looks at dependent variables such as like prevalence, mortality, these sorts of things, and tries to identify the associative or causative relationship between that and independent variables, whether it be socioeconomics, whether it be blood pressure, medication adjustments, those sorts of things. So they try to make the relationship between these causative or potentially causative variables and the outcome of interest. Now, geographically weighted regression models does that, but it does so in a way that takes space into consideration. Depending upon how you define your spatial relationships, oftentimes it says the things that are closer tend to influence the outcomes more than things that are further away, right? So like this causative interaction of space is something that is really important when we're thinking about geographically weighted regressions, and it makes sense when you think about it conceptually, right? So when we're thinking about pollution, things that are closer together are going to have similar similar levels or ppms of pollution as opposed to things that are further away, just to be incredibly reductive about the idea. So this group of authors took the Social Vulnerability Index, which is something that is created by the CDC, and it estimates relative vulnerability of each census tract or county based upon 15 different variables and 4 kind of bigger thematic subgroups. So they look at socioeconomics, household composition and disability, minority status and language, and housing and transportation. And this data set is available on the internet. It's open source, and it covers the entire United States with varying spatial granularity. So the authors took this data, and then they took COVID-19 cases between January 21st of this year and May 12th of this year as a rate by 100,000 persons. And they ran them initially through an ordinary least squares regression model, just to see if there is statistically significant relationships between the SVI and COVID prevalence. And when they found that there were statistically significant relationships, they moved on to create this geographically weighted regression. And in this geographically weighted regression, on this one, we're looking at the relationship between minority status and language as a thematic component and COVID prevalence throughout the United States. So here we're seeing, kind of particularly in the northern region of the United States, in the Northwest most specifically, those are things that are most highly related to COVID prevalence during this period of time. it looks like there was let's see, a 7-fold increase in cases in these regions when we're thinking about 1 percentile difference of minority status and language. Now, this has a lot of kind of potential for us to be able to understand the different ways in which variables influence the outcome that we're interested in. So if we, for example, take a look at the next slide, please. Thank you. This shows us a very, very different pattern. So here we're actually looking at the impact of housing and transportation on COVID-19 prevalence during this period of time. And we're seeing a tremendously different spatial scale, or excuse me, a tremendously different spatial pattern here. We're seeing down kind of in the kind of southwest region, the increase in housing and transportation is much more positively associated with COVID-19 prevalence than it is in kind of the upper regions of the United States. Now, why is this useful for us? I think everybody who is watching right now, certainly Greg, can say that this gives us kind of a smaller scale understanding or a geographic understanding of the programs that we might want to design and fund and implement in order to address social vulnerability and improve potential prevalence and mortality. I know this study is not looking at mortality of COVID-19, because we all know how deeply it influences people who are minorities in this community and people who are of lower socioeconomic status. So this is one way in which we can leverage geographically weighted regression models to understand, to create new hypotheses, to target research, funding, and design. And this is something that can be applied to many different circumstances. It's a tremendously robust tool. So I think we're going to move on to the next slide unless we have any questions. I'm going to take a quick pause and see if there's anything that's come up in the chat so far. Nothing yet, huh? Greg, do you have any thoughts so far about talking about GWRs? I know we're both really nerdy fans.
No, I think it's a great example. And for those of you who have not used the Social Vulnerability Index in some of your analyses, it really is a rich set of data. And as Erica mentions, I think particularly this year, as we were thinking about COVID, both of us are based in the Boston area, and we have seen it sort of devastate communities of color in particular. So there's no doubt that there is a very strong demographic, socioeconomic influence there, and a lot of that has to do with density and things like that. So, I think you are already getting the sense that, we live in a world of spatial heterogeneity, and trying to understand that through the application of geostatistics is critical. So I think that was a great example, Erica, of how demographic data can really be used with spatial analysis to start seeing patterns, and it provokes us to respond, which is really what this is all about at the end of the day, right? As public health people, we have a target in mind of a program or a policy or a combination of that. So keeping us on sort of the public health track. There's definitely situations, though, within spatial heterogeneity where we don't have all the data, or we don't really have, we have a lot of point data information, but we're not sure. We want to be able to have a better view of how spatial heterogeneous it is, and to be able to predict. So I'm going to talk a little bit about some of the interpolation methods, and these are both to sort of determine unknown points and their values, but also to predict them as well. As many of you know, there's a whole set of tools, just geostatistical tools to do this. Usually if you're using a software product, it's within raster interpolation tools, data set, or data tools. So there are a number of these. Some of you have probably heard some of them. IDW is inverse distance weighting and nearest neighbor, and takes a lot what Erica said about Tobler's first law, right, of things influencing other things being close together. So a lot of those are really based on distance, right? So even though you're trying to find out a value at a certain point, you don't have that data point, but you're trying to look at the influence of other data around it, of the data points you have. These are tools to help do that. And we've seen this, obviously climate data is a great example, right? Temperatures, air pollution, things like that, where you want to get some kind of smooth sort of continuous graphic of what a certain variable looks like. So interpolation allows us to do that. IDW, splining, nearest neighbor, all of those have some deterministic value in terms of trying to identify the value of a point. I want to talk about kriging as sort of the next level. Kriging is more predictive, right? It's a model to be able to do that. So it takes into account not just the weighting of distance, some points being closer than others, and the weighting of that, but it also takes into account spatial autocorrelation, right? And so those are two things that actually go into a prediction model. The other nice thing about having a prediction model, right, is that we can at least also look at its preciseness and how confident we are in predicting it. So this is where kriging, I think, takes interpolation to a higher level, because you can apply geostatistical analysis to it. So this is a paper about essentially case fatality rates, looking at case fatality rates during the Ebola epidemic in West Africa. And as you see there, it's actually a whole region, right? The whole West Africa region. So I think I can use my cursor here that everyone sees it, right? Guinea, Sierra Leone, Liberia. Oh, we can't see it. Okay. Well, it's Liberia, Liberia, and Sierra Leone, and then Guinea, which is sort of the northern tier. And those are all the districts in each of those countries. And so the point of this really was to look at spatial temporal variability in case fatality rates. And just for a quick definition, right, case fatality rates are the number of deaths, right, from a certain disease over all those who have the disease, right? And as we remember, with Ebola, it can be quite high, right? The lethality is pretty high, in the 60 to 80% range. So what this paper did was it took WHO data, and this was, for those of you who actually worked in that work there, you'll remember that WHO categorizes confirmed, probable, and suspected cases. Right, and so each of those were aggregated in each district of these three countries. And then within each of those districts, right, a spatial autocorrelation, Moran's I statistic was looked at. And so you get a sense of the spatial heterogeneity in each of those districts. So the question is, well, what about areas that we really don't know about, particularly places that were hard to reach, which didn't have a lot of data, and so on. And so that's what this kriging model allowed them to do. So what we see there in the top two maps is both the median case fatality rate in each of the districts, as well as its standard deviation. The bottom map is kind of the important one, and that is where the kriging model is done. And you can start seeing there that there's very high case fatality rates along the coast, and up into an inland, sort of in the center there, an inland corridor as well. Now, I look at that and I say to myself, wouldn't it be great if we could just overlay a road network or a health facility network, village networks on top of that? And I would say that would be the next step in looking at this. But for people who are actually doing, are tasked with allocating resources, for instance, particularly on the fly during an epidemic, this kind of analysis is really, really helpful. Now, this is certainly after the fact. And what it does is it shows the value of this model and begs for it to be used in real time. And just knowing how Ebola was, right? It was, it's rapidly transmitted. A lot had to do with people aggregating in space. And some of this could also reflect lack of access to healthcare as well. So there are many questions I think we can ask about this data, but at least we can get a sense of where case fatality rates were higher, where they tended to be lower, and to be able to use known case fatality rates in districts and to be able to have a predictive model across the entire region. How are we doing on time? Let me add one more example. And if you don't mind going to the next slide. Oh, sorry. Just before we get to the next example, we always have to test the assumptions in a model and see how good a fit the model is. And you wouldn't be doing this necessarily with some of the other interpolation methods, but with Kriging, because we are looking at spatial autocorrelation and the weighting of spatial autocorrelation, as well as distance, we essentially look at how well this model fits. And as you see there, it's what's called a variogram or semivariograms. And you can see there that they kind of fit nicely. There's a general curve up and then it plateaus, basically showing that there is a fair amount of autocorrelation, especially with shorter distances. And as you get farther out, obviously, you get to what's called a sill, where it plateaus out, and that influence of spatial autocorrelation is less. So generally, for each of these countries, and you can see them each listed there, as well as in the aggregate, that it actually, the model fit pretty well. And you can see that there's a graph of the overall for each of those countries, and then the individual countries themselves. There's still some variability, right, and some noise in that data, but generally it fits. It fits pretty well. And again, you can put a statistical value around how good that fit is for that model. And again, Kriging kind of allows us to do that. So I leave Kriging out there as something near and dear to my heart, because I think it really does take into account not just the influence of distance, but also the degree of spatial autocorrelation, right, of known points around an unknown point, and really helps us sort of predict how we might be able to use our resources and respond. And Aaron, next slide. I'm going to use one example. I'm going to go through this next one very quickly. Aaron, please, thanks. All right, very good. So I mentioned about other disciplines, right? And we talked about climate and land use. I would add urbanization, things like that. When we talk about humanitarian crises of the future, a lot of us have been talking about the influence of climate, urban populations, in particular peri-urban populations that are a little bit more vulnerable, resource scarcity, things like that. And so I want to use this as an example of bringing other spatial data in and how it affects health. So this is Kuala Lumpur. This is by Wang et al. It was in Geoscience Letters this year. I thought they did a nice job on this one, looking at land use. So they've had land use data as well as climate data. So this is the city of Kuala Lumpur. Now, this is not a city that's in a humanitarian crisis, granted, but there are other cities out there with large peri-urban vulnerable populations, right, that given a potential disaster could become a humanitarian crisis quite quickly. This is an urban heat island model. So, right, these are areas of very dense populations that and land use where you have a rise in temperature just by the fact that there's high absorption of heat in the land and a fair amount of anthropogenic generation of heat as well. So that actually is this is a data set from the city of Kuala Lumpur, where you actually see the land use. You can see how it's some areas are much more urbanized and less green space. Next slide, Erin. Thanks. So they looked at there's a model called ADMS, which is it's a software which incorporates kriging as its basis. And it allows you to put in things like air temperature, for instance. So you can bring in some climate data into this. Wind speed is another one. And you can do it over multiple periods of time. This happens to be one point of time in a dry monsoon part of the season of Kuala Lumpur. And on the right is an actual Landsat image. So this is using satellite imagery where we can actually do classifications based on surface temperature. So the right is surface temperature. The middle one is a Krieg model of air temperature. And you can see that they kind of go together fairly well. I mean, there's definitely areas there where the heat islands light up. And I put the land use on the far left just for you to be able to see how the built up environment really does correspond pretty well with those heat islands. And again, if I had more time, I would, or if I was these researchers, probably in my next paper would actually be to look at population characteristics, right? In there, are there more old people in there? Are there more people who are vulnerable, don't have access to air conditioning, things like that? Because we know urban heat is a risk factor for mortality. We might even look to see who suffers from non-communicable diseases, heart disease, diabetes, things like that would actually make them prone to more heat illness.
Certainly. I would say even things like respiratory diseases.
And respiratory diseases, yeah.
But I mean, so the role of environment clearly is important when we're thinking about public health and health outcomes. I know that NIAC et al. Published something on the heat severity index, and that's been one of my favorite articles out there to look at and understand vulnerability to environmental pressures and the actual ramifications on health outcomes. I think they did an extraordinary job, and we don't have time because we're going to move forward. But we can talk about this all day. One of the questions that just came in, and I actually think is super important, is, are there good concrete examples of these tools used in predictive modeling to guide a prevention intervention? Well, let's start off with, I have a really interesting example, if we move on to the next slide, please, of spatial optimization and the utilization of spatial optimization algorithms in order to predict how best you can spend your money on healthcare interventions and the likely outcomes of that. So I'm going to run through this quickly because we are running out of time. But Scott et al. In 2017, this is one of my biggest spatial nerd fandom papers. They look at maximizing the impact of malaria funding through allocative efficiency using the right intervention in the right location. So just very briefly, what they did is they took historical information with regards to epidemiological information, prevalence, mortality in that region. They took a geospatial epidemic model. They took costing data and they put it all within an optimization algorithm to estimate the optimal allocation of budget and projected funds across all malaria interventions in this region. So they looked at insecticide-treated nets, indoor residual spraying, intermittent presumptive treatment during pregnancy, and a whole host of different types of interventions. Their outcomes, so how well they prevented malaria prevalence and mortality, and then also their cost effectiveness. And they did this across space throughout the region so that they could report back to the public health officials and say, hey, if you spent your money in this way, you could efficiently gain some efficacy. You could avert approximately 84,000 deaths or 15.7 million cases of malaria within 5 years. Now, the interesting thing is that this has yet to be validated prospectively, and I think that that's one of the challenges. I think if we move to the next question, which is what are the challenges, what needs to be done next in order for spatial analysis to be directly incorporated into programming, funding, etc., is number one, we need to standardize and validate what we're doing. But number two, we also have to socialize the technology and really bring people who are involved in the programmatic sphere or the policy sphere or the advocacy sphere to understand what we're trying to do and what are its capacities, what are its limitations, and what it really brings to the table as something that can revolutionize humanitarian healthcare. So it's about making the science and validating the science, but it's also about taking that science to the field. It's about making sure that that technology is relevant, ethical, sustainable, something that the community, whether it be the Ministry of Health, an NGO, a public health university, whether or not they can actually implement those things in a sustainable way that's relevant to what they're doing. I think that those are two, I'm not going to say diametrically opposed challenges, but I think that there are certainly two things that need to be addressed in order for spatial analysis to really be deeply integrated and deeply influential in the humanitarian healthcare sphere. So hopefully that example and mild diatribe answered somebody's question. Greg, do you have any additional thoughts on the challenges and what we need to do next in order to bring spatial analytics into humanitarian health?
I think a lot of it is just being able to show its value, and some of the questions actually have done that. Someone asked it, for instance, on the predictive model, has it actually been, other examples were used for prevention? I think when people show that, then yes, it has absolute value, and people say, okay, this is really useful. I think, particularly, NGOs, people who are more in operational work, can always partner too with academic institutions to work on this. These are great partnerships. We're sort of putting ourselves out there as academics to say that. I think if we increase the capacity within public health academic institutions, and then partner directly with those who are actually doing the operative work, I think that just is a win-win.
I mean, I also want to shout out to the fact that there are a lot of local capacities for spatial analytics. I mean, thinking even through the Kinshasa School of Public Health that I've been in talks with around some other projects that we're working on. Like, they actually have a lot of capacity for spatial analysis, and they're doing some, but they're not doing a lot. And as a bigger, very privileged institution, I think that we have the onus and the capacity to kind of amplify their skills and create methods that are going to be directly relevant to, let's say, for example, Ebola in the DRC, right? And having these partnerships, whether they be with academic institutions or NGOs or whatnot, I think it would be tremendously critical to doing it right when it comes to bringing technology to the edge.
I think to training the younger generation as well.
Also true.
I say that as an older generation person. No, I think it's very true, and they're far more savvy with digital information. There's a lot of geospatial data out there now, and I think the younger generation is pretty facile with it, and they're also very interested in humanitarian work. So I think bringing those two together has been my experience teaching students here at the Harvard School of Public Health. That's been the case, and I think that's probably true at other schools of public health as well. Yeah.
So part of, I think, our goal here with the webinar is to even reach out and have a conversation and socialize this sort of technology and get people excited and interested and curious.
Because there's a great question here before we leave this topic. It says, with regard to democratizing geospatial analytics, I think that's a great word, democratizing. Can these models be inputted into a user-friendly dashboard or other format for decision makers? Do you want to take a stab at that one? I think the short answer to that is yes, and I think there's some varied examples of that. You know, I will say that becoming, becoming facile with different software, packages obviously is helpful, whether it's ArcPro, ArcGIS, QGIS, what have you. They have pretty much all the same tools in there. So a lot of it is sort of practicing at it. But a user-friendly dashboard, I think that would be a great product. You want to comment on that?
No, I completely agree. I think that would be an extraordinary thing to develop. I am not particularly aware of one that already exists, and I think that's kind of part of the problem, right?
Yeah, I think so too.
And it is on us as a spatial community, as GIS people, cartographers, humanitarian folk, to create something that can be utilized by people who either can't afford ArcPro or don't have the many years of GIS training that some of us do. I think one of the things that would be really important in my brain to go into that kind of dashboard / app model is that we would have to actually come up with and validate the methods that we're going to put in there for people. Right, because as I mentioned a couple of weeks ago, when we're thinking through the analysis that we're going to do, there are many different questions, many different modalities, many different associations and assumptions that we're putting into those analytics. And so we would probably want to just create and validate a handful of methods so that the user doesn't necessarily need to make those decisions, unless they want to use like the higher level advanced option, if you will.
I do think, though, that people naturally think spatially. They think in spatial patterns, and we can generate hypotheses quite easily. I think spatial hypotheses quite easily, and then that actually serves as a nice springboard to think, okay, how would I really analyze this? What kind of data would I need to be able to really see that? And I think those kinds of discussions are great, because then you can sort of whiteboard them a little bit and say, okay, here we're seeing this outcome, but maybe we want to understand the geography that influences it, however it influences it.
Yeah, certainly. And the fact that you mentioned data, I think that this is another barrier to using spatial analysis is, garbage in, garbage out. Spatial data is not, spatial analysis is not necessarily going to solve a lack of quality of humanitarian healthcare data. It does have the capacity, as you said, through interpolation to fill certain gaps, but that also needs to be validated. I know that there is an increasing amount of wonderful open source humanitarian data out there, but we always have to be very critical of how that data is collected, what is the bias around that data, and then what are the holes in that data, or how does it need to be validated before we incorporate it into spatial analytics. So I think that's like another challenge that we need to address.
I think there's definitely out in the GIS world groups that get together. I will say ESRI has some really nice tutorials as well. There are ways to learn it. Maybe QGIS has tutorials as well, but sometimes it's just a matter of just playing and experimenting a little bit with the data that's out there, and just trying some of these different tools out with data. So yeah, and not to be afraid of it. I think that's part of it.
So I think that's probably where we're going to wrap up. I think, was this yesterday? GIS Day was yesterday, Greg? Is that true?
It was. Yes, it was yesterday, but
right.
So a little bit belated, but.
Happy GIS Day to everybody. We have one more question that we'll address, and then I think that we will wrap up our webinar. They say, will you hypothesize how humanitarian health may have stronger or would have stronger investments in those desired, if those desired dashboard solutions had been available for the last 20 years? So I think that this is a hypothetical question.
Great question. That's a great question. There's probably a model around that question alone. I would think you could just draw a model. It's a great question. Yes, and it's interesting, even just in preparing for this webinar, it took me back to a paper that was published by a couple of people. Paul Spiegel is one of them, and Paul is well known, I think, in the humanitarian epidemiology world, and was a mentor of mine, has been a mentor of mine, that talked about how geographic information systems are, this is 2003, mind you, this is in disasters, published in disasters, how geographic information systems was sort of the wave of the future, and how we can't manage humanitarian health without it. I mean, that was basically the paper, and gave some really concrete examples. And I think, my God, we're 17 years later, and we probably haven't done enough with it, and really harnessed its power. So it's a great question. Again, I would look at where it has been used, in sort of a practice changing way, right? And it definitely is within infectious diseases, and definitely within environmental health. So again, I think, if we can learn from those sort of subdivisions of public health, definitely, because honestly, like you said, there's a lot of good spatial humanitarian data out there that's really useful and doesn't get analyzed. That's simply true. And there is a lot of programming that could benefit from spatial analytics, humanitarian health programming that could benefit from spatial analytics. And so yeah, I mean, I think it's a wide open world, and I think we would have gotten a lot farther had that been the case. Yes.
Yeah, I think that there are many, many examples. We only touched on a few of the ways in which spatial analysis has really changed certain programming for public health or global health. I mean, thinking about AED placement, thinking about naloxone distribution, all of these sorts of things are really starting to deeply, deeply adopt spatial analysis. And I think that we can too, as a humanitarian healthcare community. So we'll move on to the last slide, and I'm going to thank everybody yet again for joining myself and Dr. Gregg Greenough from the humanitarian the humanitarian initiative. And I also want to put a huge plug in for our remote workshop that's coming up in January. It is essentially a large extension of this. It's looking at humanitarian spatial technologies. Syra is going to put a link to either the survey or the registration, or both, in the chat. You can always visit us at the Harvard Humanitarian Initiative's website. And again, both Greg and I are very happy to have had this conversation, but continue the conversation. So feel free to get in touch with us, whether it be via Twitter or via email. So Greg, you want to read us out?
Yeah, and just to emphasize the fact that, yeah, this is still a wide open world. And even as humanitarianism has really changed over the years, we've got a lot more challenges ahead of us. And like I said, being able to understand populations in space and time is going to be critical to doing better work. And so, I put that challenge out to everyone out there, that we can do better, and we can do better through spatial analytics.
We've got another t-shirt to make.
We do.
All right. Thank you very much, everyone.
Thanks, everyone. Look forward to talking to you.